All right, blacking out.
Okie dokie. Here we go.
Welcome back, everyone. So good to see you all, and hope you had a nice little break from our Hogwarts weekend. So today we are going to cover the subject of carpal tunnel syndrome because it's fairly common in this day and age where we are consistently, if not using it for work, our hands, we are consistently using it for the computer. So this has become sort of an epidemic of sorts in this day and age. So I thought that this would be really relevant for us to go over. So before we start, let's just start with a prayer. यो विश्वं विदधाति पाति सततं संहारयत्यञ्जसा सृष्ट्वा देव्यमहांश्चदीश्च विविधान् दूरीकरोत्यामयान् विभ्राणो जलनाचकास्ति भुवने पीयूषपूर्णं घटम् तं धन्वन्तरिरूपमीशममलं वन्दामहे श्रेयसे वन्दामहे श्रेयसे वन्दामहे श्रेयसे ॐ शान्ति शान्ति शान्ति. Okay. So I'm sorry I didn't get a chance to send you guys the PowerPoint earlier, again, due to technical difficulties. But as soon as we finish with our talk today, I will send it out to everyone. So expect it to come from a Gmail and not probably my usual email, but at least that one is working. Okay? Okay, so let's get started. I do have a PowerPoint for this topic. Here we go. Okay, so carpal tunnel syndrome doesn't exactly have a very clear correlation in Ayurveda. It's sort of somewhat here and there. Ideally, how we look at it is the fact that it is a condition that is affecting your motor skills and movement of your hands. And it tends to occur or be brought on when there is excessive movement or use of that area. So hopefully that should be sending off sort of a check mark in your head of, typically a Vata sort of condition. So ideally what carpal tunnel syndrome is, or CTS, this is just the abbreviation. It may not be the accepted abbreviation, just an abbreviation to put out there. So this is a condition that occurs in the hands where the median nerve, that's this nerve right here, is compressed at the point where it passes through the spaces created at the conjunction of the carpal bones and covered by the flexor ligament. Okay, so if you look at the bones in your hands, the bones that are located right over here, they almost look like sort of weird little squares or almost like marshmallows that are stuck together. And through that marshmallow sort of conglomeration looks a tiny bit like a bridge. It's ever so slightly curved. That's why if you look at the top of your hand, it's slightly, there's a slight curvature here. So some of on the inner part of it, there is the flexor reticulum ligament that covers this area. So what it does is it sort of creates a little tunnel. Okay, so you have the bones on the upper part, and then you have this ligament that goes over it. So for instance, if you look at your hands and you see this area right here, this sort of indent between these two sort of molehills that you find, this part that you can actually palpate right here is that ligament. So the ligament is able to cover and create sort of a tunnel through which this median nerve passes, as well as 9 of the tendons that help to move your fingers. Now, the thing about this is that place that it creates is known as the carpal tunnel. Okay, so this space right here, as they've indicated in the picture, right here, is the carpal tunnel. Okay, and through that tunnel is where the median nerve and the 9 tendons passes through. And so this is sort of meant to be a protective layer in a sense, the flexor ligament. Now, the thing about it is the ligament itself here doesn't have a lot of other cushioning apart from the slight amount of fat that you have on the sides of your hand, your palms here. The cushioning is very less. So the more you use it, the more pressure that is exerted, it exhibits more amount of pressure on the ligament itself. And it's very easy for it to affect the nerves and the tendons. So a little experiment that you can do is, if you press down in that indent in between these two sort of mount hills on your hand, if you press down, you can see actually that your fingers should extend. And what that's doing is you're actually putting pressure on not only the nerve, you should feel sort of that compression, or you should feel a change in that same pathway of the nerve that you can see in the picture here. You should feel that in your hand. As well as the reason why it causes your hand to extend a little bit is because you're actually compressing those tendons as well. Okay, so that is the place that is carpal tunnel. So that's basically the area that gets affected. So the carpal bones bound by ligaments form that tunnel-like structure, or the narrow passageway. It's really important to remember that the space that is left, or the space that is created by this structure, is what is important for these other structures to pass through it. Okay, so if that narrow passageway is reduced in its actual space, then of course it's going to affect the structures. So that passes through which the median nerve passes, and also that nerve supplies the thumb. So here you can see it supplies the thumb, the index finger, the middle finger, and the ring finger. It doesn't exactly supply the pinky finger or the little finger. Okay, so typically in this carpal tunnel syndrome, you'll feel it more. They'll feel it in this, but it doesn't really affect the pinky finger. The tunnel also has the 9 tendons. So it's not just a nervous issue, but it's also it has to do with the actual movement itself of those fingers. Okay, so that's why these are all the structures that are involved in this particular disorder. Okay, so what are some of the causes? And these, we're kind of going to look through what is described about the syndrome, since this does not have a direct correlation in Ayurvedic text. We're going to look at what is known from conventional medicine, and then look at how it is translated, or what sort of comparison we can do in Ayurveda. Because in Ayurveda, we don't really have an exact name for this, but we can still understand what the condition is. And according to the condition, according to the signs and symptoms that are being exhibited, we can understand what our approach would be. Okay, so what are the causes as indicated by conventional medicine for CTS? Compression of the median nerve, and there are multiple ways that can happen, and factors that crowd, irritate, or compress the median nerve in the carpal tunnel space. So the median nerve it's not only there in the hand, it actually is there all throughout the mid-arm and the forearm, and comes all the way down to your hands. But it's specifically compression at the space at the carpal tunnel space. Okay, so that may occur, for instance, if there's a wrist fracture, or if there's swelling and inflammation in that area. So for instance, you may even find somebody getting carpal tunnel if prior to that they've had rheumatoid arthritis, because even in different forms of rheumatoid arthritis, which we have discussed, you can see that there may be swelling or there may be inflammation. And that can translate to then affecting the space that is there in the carpal tunnel. So if that space, remember I was telling you the space is really important, because if that space reduces, then it starts to compress all of the other structures, such as the nerve and the tendons, that passes through that little tunnel, okay? So due to compression or pinching of the median nerve, such symptoms such as numbness, tingling, pain and discomfort in the wrist and hands, difficulty in gross movement of the hands. So that's like, for instance, if you want to hold on to a door handle, or if you want to hold on to your steering wheel, or if you're trying to hold a book open, any sort of movement or gripping sort of sensation where you need to use all of these fingers and you're sort of creating this sort of structure with your hands, that is going to become more and more painful the more chronic this condition is. Okay? So difficulty in these sort of gross movements. This is sort of a gross movement. The finer movements are the ones that you have more with the digits and in your hands, okay, or your fingers. And also here you may find that it can be associated with early morning stiffness. So for those of you who had some little things pop into your head, or hopefully this seems like something familiar, what we had talked about over the weekend. Does anybody know or anybody remember where we saw this early morning stiffness, especially in the hands or fingers? This also may occur in certain types of Vata Rakta. So that's also another nice little indicator here that this condition may also be very similar to Vata Rakta. Now, the difference in Vata Rakta and this condition is the fact that Vata Rakta is occurring more in the actual sandhi, or the joints, whereas this is occurring actually at the area of the nerves and the tendons, okay, as from the Ayurvedic perspective. So the nerves and the tendons it's the same sort of issue, the same manifestation, but in a different place. Instead of it being at the joints that we talked about, remember, we talked about how you would test the joints. Instead of it occurring at the joints, it's occurring at the nerve and the tendon, okay? Or it may occur here and then spread to here, but the cause may be the same. Now we'll discuss this in a minute. So these are some of the typical sort of symptoms that you find with carpal tunnel. So here, this is somewhat what we look at from the Ayurvedic perspective of what carpal tunnel is. Now, it's not an exact translation. Vishwachi doesn't mean that it is only, it doesn't mean that it is only carpal tunnel. It can also, as you can see here, Vishwachi is a disease which causes contraction of the tendons of the palms and fingers, or even the back of the arm, which is basically the shoulder and the deltoid area. So here, even if you have this sort of frozen shoulder or this type of pain, but it's occurring more on this side, on the back of the shoulder or the back of the arm, that also can be considered as Vishwachi. So it's not just carpal tunnel alone, but it's also indicating other symptoms. Looking at that sort of muscular group and looking at that sort of nervous pathway, that you can feel, you can have this sort of pain there as well. So in Vishwachi, when this disease occurs due to contraction of the tendons, it can lead to loss of function of that arm, okay? And this, if we look at it, if we look at the description here, it seems like a very small little description, but from this description and from what all we have talked about, this again very much indicates that it is a Vata Vyadhi. In fact, Vishwachi is one of the Vata Vyadhis that have been described. So it can occur due to aggravation of Vata that settles and manifests in the hands, or basically the extremities. And because of the fact that it's occurring or it's settling in the extremities, indicates that it has to be an association with Vyana Vata. Now, if we look at all the different types of Vata, or the different subdoshas of Vata, the subdoshas of Vata, none of them actually get to this aspect of the extremities or the whole body other than Vyana Vata. Vyana Vata is one of the main types the only one that circulates all throughout the body. So again, it's not directly a circulatory issue, but it is the fact that that type of vata that has access to the whole body, if that vata gets stuck, or if it gets aggravated and it gets stuck in one place, then that can cause, again, the vata-related conditions, signs, and symptoms. And you start to see, again, the indication of a vata-aggravated condition or disease. Okay, so here what they've described is what are the causes for aggravation of Vyana vata, not just Vishwachi in particular. So for those of you who were there for the neurological module, neurological disorders, remember when we talked about different causative factors, we said though we are talking about all of these different diseases or disorders, they are ideally, the causative factor is still the same. The causative factor is that which aggravates vata. So vata gets aggravated, then it looks for the weakest spot in the body. Remember, we had this discussion as well. And then according to the weakest spot, or the place where you use that spot more often, then that's where the vata will settle and it will start to create symptoms. It will start to create a disorder or a vikriti, okay? So for instance, in this particular condition, where there is more amount of movement or use of the hands, the same aggravated vata settles in this area and it starts to produce a vata vyadhi, okay? So the causes for what can cause an aggravation of Vyana vata: excessive walking, because that's a type of activity that involves the whole body, okay? Too much of sexual intercourse, because what this is doing, this is an activity that involves the whole body, but also apart from that is the fact that if there's excessive sexual intercourse, there's excessive loss of shukra dhatu. And there is also can lead to loss of ojas, which will automatically cause vata to rise. Shukra dhatu is one of the most nourishing, the last of the dhatus, and that is really required to help to ground the body and create more amount of strength, which is its main byproduct or the essence of after the formation of shukra dhatu is ojas. Okay, so that is essential to the person or the body to have a certain amount of strength and stability. It is basically what is a person's bala, okay, or their strength. Also described as their vyadhi kshamatva, or the ability to fight against the manifestation of disease. Okay, so if shukra dhatu is reduced, or if there is too much excessive loss of shukra dhatu, then that can be a very easy way for Vyana vata to get aggravated. Okay? Worry and stress, and we have discussed this as well, as how worry or how stress can increase Vyana vata. Stress is something that is ideally manifesting in the mind. It is an excessive, erratic movement of the mind. And what we have also looked at is the fact that the mind, the relation of the movement of the mind is very closely related to the movement and the flow of vata as well. And of course, here we're looking at Vyana vata, which is that which is moving all throughout the body, just as the mind is also moving all throughout the body. So if the mind is aggravated and has this erratic sort of movement and flow, then automatically it will affect the movement and flow of Vyana vata as well. Okay? Improper use of the affected area. So for instance, here that's a little bit more specific, but it can be generalized as well, and it can be specific as well. So for instance, if you are running too much, or if you're walking too much, or if you're tapping your feet too much, any sort of excessive movement of a particular part of the body will obviously cause vata to get aggravated in that part of the body. Similarly, if you're using your hand too much and in an inappropriate way, then it can obviously cause vata to get aggravated and settle in that area. Okay. Viruddha food, here again. Now we're starting to see why this Viruddha food is so important and how it is actually a direct causative factor for production of disease. So prior to this, we had learned about incompatible foods and why they're not good for us. And we looked at this massive long list of things that we should avoid. But I know a lot of people have had this idea that I still don't understand why this is so important, or I still don't understand what we're supposed to do with this big long list of incompatible foods or foods that we should avoid. If we go by that list, that means that we can't have anything, okay? That's typically, it sounds like that. However, now if we look at diseases, it's connecting all of that information. So when we said earlier that Viruddha ahara or incompatible foods are not good for you, it can cause disease, this is now indicating what diseases it causes. And why it causes this disease is because of the fact that it affects the flow of vata, it affects the quality of the shrotas, it affects how much moisture or lack thereof there may be in the shrotas where vata is moving. Therefore, that can be a slow and progressive cause for the doshas to get aggravated and then to build and build and build to produce disease. So though it seems like an insignificant factor, it does have an important role because as we have seen with our clients and as we see time and time again, Viruddha ahara usually doesn't come as just one particular type of Viruddha. Usually the person who's consuming this type of food has much more than just one type of incompatible food habit that they have. It's one thing upon the other, or a frequency of having it every single day that will build. So the more often they're exposed to it, the more it's going to build, the more it's going to affect the doshas. Okay? And here exactly it's affecting Vyanavayu or Vyanavata. And of course, excessive dry food as well, that is fairly obvious, that will aggravate Vyanavata because what it does is the dry food will start to absorb or dry out the body itself. It'll absorb the natural amount of moisture that is needed. And therefore, when it dries out the moisture, it creates more space. So Vyanavata moves more faster and more quickly gets aggravated. Okay? Also, too much fear. So fear, we know, will aggravate vata. Also, joy. So it's funny, you think, why would too much joy create disease? Well, it's not exactly joy. It's the sense of the effect or the action that you do. So for instance, have any one of you ever noticed, like if you laugh a lot, sometimes you end up with a headache afterwards? Because that laughing itself is an action that is a lot of udana vata that's going in and out and in and out and in and out, okay? And that excessive movement of that udana vata will cause an aggravation, okay? So if it's not just a little bit of joy or good joy or a little bit of laughing, but if it's excessive for a long period of time at one go, then yes, it can cause an aggravation of Vyanavata. It can cause an aggravation of Vata. So here we're not looking at it specifically only for the hands. But as we know, when Vata gets aggravated, it doesn't necessarily have to start here. It can start from the GIT. It can start anywhere else. As long as Vata gets aggravated, once it is aggravated, it looks for the spot in the body, which is the Kavegunya. It looks for the weaker spot in the body or this place where there is more amount of space, and then it settles there, and that's how it manifests as that particular condition. Okay? So similarly, sorrow and grief, all of these affect the flow of vata. They affect the flow of, or the rhythm and the pace of the mind, and therefore they also affect Vyanavata. Okay? So the symptoms, what are the symptoms of carpal tunnel syndrome? Of course, tingling and numbness. And if you all remember, tingling and numbness, these are all symptoms of, again, vata vyadi. These are Vata-related conditions. So it occurs typically again in the thumb, the index finger, the middle finger, or the ring fingers, because that's where the median nerve is supplying. It's supplying these 4 fingers. The sensation often occurs when holding a phone. So that's, for instance, the nerve that's supplying here. If you do this sort of activity, again, you're compressing or reducing more of that tunnel space. So in this particular movement, it actually reduces the tunnel space that then causes even more compression of the nerve, so it can become more painful. Okay? So the sensation of the tingling and numbness, here in this particular instance, it's actually compressing the nerve itself. That's why the person starts to lose the sensitivity of touch or the sensitivity of feeling in the fingers, leading to more amount of numbness. Holding the phone, holding a magazine, a steering wheel, or even a garden hose, the sensation may even extend to the forearm. So depending on the chronicity, it may start off first affecting their fingers. They start to feel, usually start to feel it here at the actual area of the carpal tunnel. Then you start to feel the tingling or even the numbness. Then the more chronic it becomes, the more painful it is, and then it may even extend to this area of the median nerve as well. Okay. It may also be associated with some tremors or trembling. And again, those are symptoms of aggravated vata, which is, remember, kampa vata, the uncontrollable movement of the hands that you find, not just hands, but the whole body. But in this instance, it's just at the hands. So some people may say that, if they shake their hands out, have you guys ever felt this? Like if your hands are really cold, or if they start to get stiff, or you start to get sort of these sort of symptoms, you shake your hands out like this, and that kind of helps to temporarily relieve the pain. Because what this movement is doing, it's sort of helping that vata to move out a little bit. So it doesn't move it out completely, and it doesn't get rid of the problem. But what it does is it displaces it ever so slightly, so that it will help to relieve the compression on the nerve. So that's why that shaking out the arm or shaking out their hands does help to temporarily relieve the pain, but it will not get rid of the pain. Okay, after some time, if they start using it again, the pain will come back. Other symptoms is it may cause weakness, and the weakness is actually when it starts, the more chronic and the more it starts to compress upon the tendons that supply these fingers, that give you the ability to grip and hold on to things. It may also then cause those tendons to become weak, and therefore it's not able to withhold or to have that much strength to hold on to stuff. Okay, so there may be a tendency to drop objects. And of course, pain. So the pain tends to occur in the wrist and the hands. Intensity of pain rises upon greater amount of activity, and it tends to reduce upon rest. So for instance, if the person is using it more, it's more painful. When they rest and they don't use their hands, the pain can subside. And that typically tends to happen when it's of a more recent onset. As it gets more and more chronic and left untreated, and the person continues to use their hands, then of course it can develop or graduate into constant pain. Okay, not intermittent pain. In the earlier stages, it can be intermittent. So intermittent means it comes and goes. Again, another very typical sign of a vata condition. Whenever there is a vata condition, it's never constant. It's always here and there and here and there. When it gets to the point where it's constant pain and it is still a vata condition, that means it's gotten to its chronic state where vata has gotten really nice and settled in that area, and it's not moving. It's not moving at all. So that's when you end up with the constant pain. Okay? If left untreated, it becomes severe, and it can also affect the sleep patterns because due to the severe pain itself, it can actually affect the person's sleep. They won't be able to sleep because it's it's too much. And also, if you notice that whenever there is pain, regardless of if it's just in the hand or if it's in another part of the body, whenever there is pain, it's hard for us to sleep. The reason why is because the pain center in your brain and the sleep center in your brain are actually kind of right next to each other. So when you have pain and that part of your brain is activated, it automatically starts to stimulate a little bit of the sleep part of your brain that is very close to it. Okay, so that's another reason why pain can affect your sleep. Apart from that, from our perspective, from the Ayurvedic perspective, of course, pain is an indication of aggravated vata. And whenever there's aggravated vata, it is very hard for, again, the excessive movement of vata, as well as the excessive movement of the mind. Remember, we talked about how sleep induces and the physiology of sleep? In order for sleep to manifest, it needs to withdraw from the senses and from the sensory objects so that it can then withdraw back into its original state of consciousness, and then that's how sleep manifests. However, if there's too much of movement of vata, including too much of movement of the mind, then it's very hard for it to calm down and for it to retract away from its stimuli, and it's very hard for the person to fall asleep. Okay? So in the more chronic conditions, it may affect sleep patterns, and it can also lead to, of course, nerve and muscle damage. Okay, was there a question here? Another condition called thoracic outlet syndrome has some of the same symptoms. When you have time, can you explain this? Okay, maybe we can look it over. It would be great if you guys could send me some of the topics on this, like some of the other smaller conditions that we would like to discuss. Because ideally, from the Ayurvedic perspective, if we're looking at musculoskeletal disorders, the major ones that have been described in the classical texts are Vata Rakta, Amavata, and Sandigata Vata. Okay, which is what we discussed over the weekend. However, that doesn't mean that that's all there is for musculoskeletal disorders. Now, in Ayurveda, as you can see, especially in this condition, it's not an exact direct translation, but even if somebody comes to us with other conditions like this, or like any of the other smaller conditions, we look at it more in the perspective of doshas. So it's good to know the name of what your patients or clients will come to you and say, oh, well, I have this, or I've been diagnosed with that, or I have carpal tunnel syndrome. I think I have carpal tunnel syndrome. But again, we're going to look at the symptoms, and we're going to look at that condition. So being able to hear these terminology, but still be able to look at it from an Ayurvedic perspective is important. So even though it's not there in the classical text to pull out and say, okay, we're going to discuss this chapter today, instead of looking at what is found in this day and age and how we can look at that through the Ayurvedic lens. Okay, so if you guys would like to send me a list or send me a couple of ideas of what you would like to talk about, we do have a few extra webinars in this module since we didn't have the pre-webinars, that we have time that we can cover them. Okay, so those are the symptoms for carpal tunnel syndrome. So this is, again, if you look here at the symptoms that have been described for aggravated Vyana Vayu, if Vyana Vayu is getting blocked, or if it is aggravated, or if it is moving in an abnormal way in the body, these are the symptoms that we can observe. There may be swelling in the body, okay? It may cause disorders of the mind, again, the flow of the mind and the flow of Vyana Vata. It may also induce fever. It may cause fever. And how that happens is, if there is excessive Vyana Vata, it also starts to easily affect the other Vatas as well. Because this is the one that is connecting actually all the Vatas and everything else in the body to each other. It's what there is that causes circulation and movement, okay? So if Vyana Vata is aggravated, what it can easily do is affect the intensity or affect the function of Samana Vata, which, if it is aggravated or if it is blowing too much, can actually blow out the Agni. in the sense it can cause the Agni to rise very quickly and then diminish very quickly. Or also what may happen in certain types of fevers, if the Agni diminishes, it can also cause it to be displaced. And in that sense of the Agni being displaced is that Samanavata or that Vyanavata can fan the Agni in other parts of the body without fanning the Agni or igniting the Jataragni. Okay, so when there is that, again, that abnormal flow or that abnormal movement of Vata, then it can obviously affect how the Agni is intensifying or carrying out its function or not carrying out its function. So in fevers, again, remember, typically fevers are caused by when there is a lower Jataragni or a Manda Jataragni that can cause ama, and then it causes the heat part of the body to be displaced from the center to the extremities, okay? And that's exactly what this aggravated Vyanavata is also doing. It is lowering the Jataragni and displacing the heat to other parts of the body because of its excessive, irregular circulation and movement. It can also cause paralysis of one part or even the whole body. Again, same circulation, movement of Vata throughout the whole body, and if it's excessive, it can cause lack of movement. If it's, for instance, if it's circulating somewhere else and stuck somewhere else, and it's not circulating and it's not allowing movement of that particular part, then of course it can cause in one part of the body or the whole body. And this is exactly what we saw in the case of Pakshagada, and in the case of hemiplegia, and some of these other upper motor neuron lesions, okay? What aggravated Vyanavata also can cause intermittent pain, because again, it's moving all over the place. So wherever it's concentrating here, there'll be pain there. All of a sudden it'll move somewhere else, so the pain subsides. Then it'll come back again, then the pain will be there again. So it's constantly moving, so there won't necessarily always be constant pain. When it gets to the stage of constant pain, it's indicating something else, okay? Loss of tactile sensation, again, Vyanavata. Again, very similar what we find in carpal tunnel syndrome. So here you can see, even though it says swelling of the body, you may find it as swelling in this particular instance, swelling in the hands or swelling in the fingers, okay? Goosebumps or horripilations, that may also occur due to excessive Vyanavata. Skin disorders or kushta and other diseases that affect the whole body, okay? Risk factors. These are some of the risk factors as described by conventional medicine, and some of them do kind of align with what we are looking at as well. So some of the risk factors are, it can be an anatomical issue. So for instance, a wrist fracture dislocation may create, again, more pressure in the carpal tunnel, which compresses the median nerve. Do you remember when we had talked about surgeries and people who have recovered from surgeries, that kind of is a kave gunya there as well? The fact that they, if they have a surgery, they have a fracture, or they have a break in the flow of Vyanavata, then that can cause, obviously, a tender or a weaker part of their body. So it's very easy for Vata to aggravate there and cause this pain, okay? Another risk factor as described is, for instance, sex, as in women tend to be more prone to getting this condition because their hands tend to be slightly smaller, or the space in the carpal tunnel itself tends to be a little bit smaller. Yes, I know we are talking about the size of people's hands. So the tunnel itself can be smaller in women's hands, and they say that even women who have smaller hands or have smaller bones are even more prone to getting this sort of condition compared to women who tend to have larger, more stronger bones. So maybe we can say, basically, if you want to look at it in that perspective, we can say, for instance, if a person is Vata Prakriti, they are more prone to developing this carpal tunnel syndrome, as opposed to someone who maybe a Kapha Prakriti will be less likely to develop this carpal tunnel syndrome. I think what would be a really interesting study is for us to look at these same vata vyadis that we've talked about and sort of track and see how many people who are vata prakriti that are developing these conditions. And also, apart from just being vata prakriti, if they're just vata prakriti alone and they're developing it, if they're vata prakriti plus they have a vata aggravating diet and lifestyle, that's why they're developing these conditions. Or if they're another prakriti and they have a vata aggravating diet and lifestyle, and they are exhibiting or they're developing these sort of vata conditions or vata disorders. So that would be interesting just to get sort of a demographic idea, and to see all of the other confounding factors, the factors that we always talk about. So for instance, the person's environment, or the age, or their job, all the other factors, the environmental factors that we keep talking about as the trigger factors that either play into the disease or not. To actually have a study, to develop a study, just to track and see how much of could this be, could we use it as predictive factors? Because we know that they are, we can expect this, or we anticipate these things from the Ayurvedic perspective, but we don't actually have any numbers as such to say that. So I just thought it would be nice to be able to do something like that and just get some percentages and maybe even be able to indicate a trend. Okay. So back to risk factors. So for instance, if there is nerve damaging conditions such as diabetes, because in diabetes, of course, it starts to affect the nervous conduction. And from the Ayurvedic perspective, in diabetes, what's happening is it's affecting all the shrotas, and it affects the amount of moisture in the shrotas. So if there is excessive amount of moisture in the shrotas, then that obviously will slow down, or it can even block the flow or the movement of Vyanavata. And so that's very easy for it to then accumulate and get stuck in certain areas, especially in areas where there are smaller spaces, and they are more prone to developing issues in earlier stages of uncontrolled diabetes compared to some of the other areas. Okay. That's why you find most of the complications of uncontrolled diabetes tend to be in areas where the spaces itself or the channels are very small, very minute, such as in the retina, or the blood flow to the eyes, or such as the veins and the drainage of veins in the feet. And also because of that, circulation also starts to affect the nervous conduction in the feet, which again is something we had talked about with Padadaha, or the neuropathy of burning in the feet, and Padaharsha, which is the same neuropathy in the feet where there is more of that pins and needles sensation. Okay, again, pins and needles, another Vata condition. So inflammatory conditions. So this one actually is describing where it could be due to an involvement of not just Vata alone, but other factors that is affecting the flow of Vata. Okay, so such as in rheumatoid arthritis, with which it can affect the tendons in the wrist. So if a person has developed rheumatoid arthritis first in the hands, and it starts to spread, or it starts to affect again the flow and circulation and these smaller areas, then yes, it can spread to the wrist as well. And from our perspective, that these two wouldn't be really considered as two separate conditions. They would just be considered as one condition. So as you can see here, again, we're looking at it more systemically as opposed to looking at it more localized. Okay. Other conditions that affect the bodily fluid balance. So for instance, especially again here in women, if there are conditions such as pregnancy or menopause that does affect the amount of fluid or the amount of moisture in the body, then that can also increase the pressure in the carpal tunnel. So an example of this, for instance, is me. I've had this happen. So for instance, when I stay here, when I'm in the US for a long period of time, and I go back to India all of a sudden, the extreme change in temperature or heat factor causes my hands and feet to swell up in the first couple of days. And because of that excessive amount of fluid in my hands, I do develop temporarily symptoms very similar to carpal tunnel. It feels almost, not only are your hands swollen because there's a lot of fluid here, but it feels like it's difficult to even do this, not just because of the resistance of the fluid, but also because there's weakness. It's very difficult. And it also feels, I do get that numbness, start to feel numbness because it's compressing. That amount of fluid accumulation and the swelling occurs, and it actually starts to compress the median nerve. So I can feel the pain, somewhat of a pain and discomfort sort of radiating. I feel it throughout here. And it can become pretty painful until it does drain and it starts to subside and the swelling goes down, and I acclimatize myself with that sort of external temperature, and then it subsides. But with the immediate rush or the immediate swelling that occurs in the first two or 3 days, it produces again that same sort of pain. So that's kind of exactly what they're describing here, is this bodily fluid balance. If there's too much of fluid, can increase the pressure in the carpal tunnel, therefore increasing the pressure exhibited on the median nerve and also on the tendons. Okay, so another quick factor, of course, this is what goes very much aligned with what we talk about in Ayurveda in looking at the workplace factors, so the actual activity itself. So working with vibrating tools that do cause more pressure on this part, assembly lines or prolonged repetitive flexing of the wrist. So for instance, like typing on a computer, that can obviously cause excessive amount of pressure in this area and therefore cause the carpal tunnel syndrome. So there was a couple of studies that have been done to look at computer use as a causation. Like for instance, if you're using the computer for too long, if that can be a causative factor for developing carpal tunnel. However, these studies have been considered somewhat inconclusive because they say that there is not enough quality of evidence to support this theory. So it may be considered as a risk factor, but it cannot be labeled as a cause for carpal tunnel syndrome, which seems sort of, in a way, ironic because the studies and the numbers may not necessarily be indicating it because there are a lot of other factors as well. However, anyone who does use a computer for a long period of time will instinctively tell you that they either feel some intensity or some aspect of these symptoms that are described in carpal tunnel syndrome. So though the studies are not indicating that this is a causative factor for this condition, it clearly is a causative factor for the condition. So I just wanted to put that out there because it seems like common sense for practitioners or for people who see clients who have this problem. But it's funny that even the studies cannot completely agree because the numbers don't match. Okay, so I just wanted to add that little tidbit of information for you. Okay, so in saying that, when sometimes studies, you do have to kind of take the findings of that with a grain of salt. Just putting it out there. Okay, so the causative or the types of carpal tunnel syndrome, if we want to look at it from an Ayurvedic perspective. And again, this is more of an interpretation. This is not there in the textbook. While I was writing up these notes and I was making this this PowerPoint, it became very apparent that you can consider them as two types of carpal tunnel syndrome from an Ayurvedic perspective. And in these two types, it's again describing the same thing as we saw in the causative factors for aggravated Vyanavata and the presentation, okay? So for instance, there are two types that we can look at that we may find. One is a purely Vataja type, where you find that it tends to occur again more due to an aggravation of Vyanavata. You will find all of the factors. So for instance, in our list, where we would go through the Dashavida Pariksha and Ashtavida Pariksha and look at all of the factors that we find, we ask about diet and lifestyle and all of that, we'll find everything pointing more towards an aggravation of Vata. And in your checklist and in your differential diagnosis, whatever things you ask to figure out if there are any other doshas involved, you may find that, again, everything is pointing more towards Vata, and the others are there, but they're not aggravated. And they're there, but they may not necessarily be contributing to this particular condition. So in saying that, in the Vataja type of carpal tunnel syndrome, there won't be Vata will be aggravated, but there won't necessarily be an involvement of another dosha. So this may exhibit with, again, you'll find more intermittent pain. The pain is really irregular. There's no sort of pattern. And obviously there tends to be more amount of numbness. Then the extent of numbness tends to be more in a Vataja type. One thing that you can look for if you want to figure out if it is a Vataja type or a Vata with Rakta or Pittaja type, in the Vataja type, you want to look for depletion of the fingers. So what I mean by that is you want to examine the fingers, right? And if there's compression here, what it's compressing is, it is compressing the nerve and the tendons, but to some extent it will be compressing the nutrition that passes from this part of your arm to your hands. So look to see if the fingers themselves look thinner than the other hand. If both hands are affected, both hands have carpal tunnel syndrome, then compare the thickness or the quality of the skin on the hands compared to other parts of the body. Okay, so remember when I was telling you about sort of the darkening of the knuckles? That happens when it is right there when Vata is aggravated at the joints. Similarly, if Vata alone is aggravated here, have you guys ever seen people who have blue hands and their hands may be blue at the fingers, which indicates a circulation, but some people develop sort of a blue patch right here. It tends to look really, really blue, or it looks almost like somebody put ice on their hands and they've had it there for a really long time. Look for that, because that again is indicating that it is a Vata condition and Vata is stuck right here. Okay, so again, we don't necessarily have a name for it. Doesn't mean that we can't see the doshas. We'll still be able to see the doshas in these conditions. So these are some things, again, all Vata signs and symptoms. That's what you're looking for. So depletion or reduction in the thickness of the fingers, reduction in the thickness of the palm. If it's just one hand, look at the size or the thickness of the palm of one hand compared to the other. If Vata is aggravated in this hand, this one will be slightly thinner or depleted compared to this one. And of course, that is contingent on how long these symptoms have been occurring for. The longer the symptoms that are occurring, the longer the aggravation of Vata, the more it will start to affect the structures. Okay? So you want to compare the fingers, the wrist, the thickness of the palms compared to the other one. If the fingers look abnormally thin, or also if there's more prominent bony protrusions. So for instance, even though this is partially affected and it's not exactly affecting the bone, in this particular condition, again, if it is Vata that's aggravated, Vata won't just be affecting the nerve and the tendons, but it will start to affect everything else around. So what you can look to see, if it starts to deplete or it starts to basically dry out the surrounding structures, it will not only dry out the muscles or the fat that reduces the thickness, but it will also start to dry out the cushioning. So what you'll notice is instead of it having a regular bony protrusion, say here or here, this is a very common one. You see this little part right here that just pokes right out. I think this is a xyloid process. it becomes very, very prominent. So again, vata is located right in this area and it's starting to dry out. Therefore, the bones become very, very prominent. That again is a very typical sign that you find when it is a purely vata condition. Okay? So that's kind of what you want to look for the vata type. For the vata, when it's vata that is aggravated because of aggravated rakta or pitta, or even in the sense of fluid imbalance. Fluid imbalance, again, tends to happen when there is a rise of pitta. So the fluid tends to rush to that area to help to sort of soothe it or to calm it down or to help to pacify some of the heat of it. And in that sense, that can cause, again, that fluid imbalance. So Vyanavata that is obstructed by aggravated rakta or even fluid imbalance, fluid balance in the body, it's concentrated in one part and not necessarily evenly distributed, then in that situation, if you have carpal tunnel syndrome, there will be more amount of swelling. Very similar to the signs and symptoms or the differences between Vata Rakta and Sandhigata Vata. So Vata Rakta here, Vata and Rakta, or Sandhigata Vata, which is again a condition that is purely a Vata condition. The only difference is that one is manifesting or localized in the joints, whereas in carpal tunnel syndrome, it is localizing in an area where there's bones as well as the tendons and ligaments joining together and the passage of nerves and other tendons and ligaments, okay? So there are multiple structures. It's not exactly just a joint alone. It's multiple structures involved, but there also vata can get aggravated, okay? So that's kind of the difference is what you want to look for. So in the vata and rakta or pitta type, there'll be more swelling, more amount of tenderness, which means if you touch it, it's more painful. There'll be pain in the morning stiffness, which again, vata rakta, another sign of vata rakta. And also seen in vata rakta of the joints. So you can basically say this is vata rakta of the tendons, and that is vata rakta of the joints, which is similar to rheumatoid arthritis or certain cases of gout, okay? It also, you want to look for, again, same indication of not just vata, but vata and rakta. So you want to look for red patches on the wrist, as opposed to it being blue, it may be red in this condition, where it's more red on the wrist or red in the fingers or anywhere on the skin. If there is excessive redness, indicates again the aggravation of rakta as well as that affecting the flow or the movement of Vyanavata, okay, and localizing in this area. So here again, we can see that you can have, these are more systemic issues, which again goes back to our same description of it being autoimmune. It is autoimmune. It's the doshas that get aggravated and then fight the body and then start to create changes, abnormal changes in the body, okay? Next, these are the examinations that have been described that is typically done for carpal tunnel syndrome. So for instance, they do a physical exam. They do that to test the feeling in the fingers and as well to test the muscle strength. So for instance, they may ask you, to press down or to hold certain objects, to look at the grip. They'll check to see that. They'll also may apply pressure to the nerve. And if you're applying pressure to the nerve, of course, that typically enhances the pain. So for instance, that includes bending of the wrist or tapping on the nerve or even pressing down, compression of the nerve itself, to check the intensity of these symptoms and also indicate maybe if there's any further damage, okay? Also, they look at the history of the symptoms, the pattern of the signs and symptoms, like how, if there's intermittent pain or if there's constant pain. That's again, if it's recent cases, the pain increases upon activity and subsides on rest. Chronic ones will increase, or it can even graduate to constant pain in a more chronic condition. They may also indicate to do an X-ray to rule out other causes for wrist pain, such as fractures or arthritis. There may be an electromyogram, which is basically they test to see the electrical discharges or the tiny little signals that are produced in muscles to see if the muscle conduction is still there. That's if muscle damage has occurred, sorry, typed too fast, and may be used to rule out other conditions. Nerve conduction study, that is to look at the health of the nerves, of basically the median nerve. So 2 electrodes are taped to the skin and a small shock is passed through the median nerve to see if the electrical impulses are slowed down, okay? Typically, the conventional treatment for this condition, they use wrist splinting, which is sort of like, you know, you get these at most of the pharmacies where you have a splint or like a little sort of a glove, but for your wrist. You put it on, you can tape it up. And this tends to help to compress and hold the wrist in place. They typically advise to use this at nighttime because it can help to reduce some of the night symptoms. This, I will explain this in a second as to how the Ayurvedic perspective of this actually is somewhat of a good idea to do that. And there are other conditions or other types of treatments. They use NSAIDs or non-steroidal anti-inflammatory drugs such as ibuprofen or Motrin, which are basically painkillers. Also, they can prescribe corticosteroids, which help to induce inflammation. Of course, now in looking at the different presentations, you can have it with an inflammation or you can have it without an inflammation. The main thing is you need to look at if there is an inflammation, then this would actually help. Whereas if it does not, if it is occurring even without an inflammation, then in that condition, in that situation, this really wouldn't help. Also, there are other factors of where they may opt for surgery if in very chronic states, and that is basically to remove the pressure on the median nerve. So what the surgery would do is they would actually, here, let me show you. They would actually incise and they can actually cut a bit of this ligament off so that once this ligament is cut, it can actually reduce the pressure on the median nerve, which is basically kind of opens up that tunnel that is created by this ligament, okay? So, in looking at that, these are the perspectives of conventional treatment. The Ayurvedic treatment for this, however, again, it is based and depends on the type of condition or the type of carpal tunnel from our perspective. So if it is a purely Vataja type, then we do Vata management. If it is a Vata and Raktaja type, then we need to do management of that. And if you look at this again is very similar to what we looked at in the treatment of Sandhigata Vata or Vata Rakta. Okay, so you can go by the list that you have in your notes. It's almost exactly the same. Or you can use this here. It's basically same concept, okay? And same logic behind what you would choose. So in a purely Vataja condition, again, it's due to aggravated Vata that's building and stuck in a place that it's starting to dry out, it's starting to affect the tissues, it's starting to affect the nerves. And so in that case, we need to pacify the Vata and help to induce better movement or flow of the Vata. So the easiest way to do that, of course, first snehana or oleation, and that is always followed by swedana or fomentation. So snehana, you can choose some options here. You can do it with sahacharadi taila, and that's basically just applying it on, or even doing a pichu, where it's the gauzed, soaked with any one of these oils. And that is applied on for a good about 25 to 35 minutes, and then it's followed by some form of swedana or heat application. So you can use Sahajaradi Tela, and the reason why Sahajaradi is a very good option in this case is because it does promote nerve conduction, as well as it, of course, it does pacify Vata. It is a Vata pacifying oil. But apart from just pacifying Vata systemically, what it also does is it does have this added effect of promoting nerve conduction. So that's why Sahajradi Tela is a good option for this particular type of Vata condition. Or you can also use Mahamasha Tela. And this option you might want to choose when you find that there is more amount of depletion. If you find that the structures surrounding is really starting to be depleted and thin, like for instance, the Vata is starting to dry out the nourishment or the thickness of the palm or the particular health and structure of the fingers, if it's starting to have more of that bony prominence, then that's when you want to opt for Mahamasha Tela, because it pacifies Vata, but it is also a very nourishing type of oil. It's more Brahmana or nourishing in nature, and it's very good in rebuilding of tissues. So when you find that there's a depleted case, then Mahamasha Tela is a better option. Okay. Next, that is typically followed by Swedana. So we had a good example of one type of how we use this for this Swedana. We can use Patra Potali Sweda, which is the poultice made out of cooked leaves. Patra means leaves. Potali is the poultice which we had made, and we use that for applying Sweda, or we use that for applying heat. So for instance, you can cook castor leaves if you have castor leaves. If you have access to castor leaves, great. So you can cook castor leaves in a little bit of castor oil. Or if you don't have that, Nirgundi, which is the Vitex Nirgundo. In certain areas, again, mostly in the southern part of the US, it does actually grow quite wild. So if you have that, you can use that. If you have access to Calotropis, which is Arka, it was there on the list of herbs that can be used. If you get fresh leaves of that, then cook that in castor oil. Or if you don't get any of those and you're in the New England area where you have lots of access to nettle leaves, this is when you want to use your nettle leaves. So you can use their nettle leaves and saute them in castor oil. So when you're sauteing it, as we saw that even when we boiled it, it did help to get rid of that sort of biting sensation that it has. So the small little fine hairs, they tend to go down once it's exposed to heat. So you can actually somewhat saute them ever so slightly so that once it starts to change color, that's when you know it's enough. So it's probably about 3 to 5 minutes you saute it in the oil. And then you can use that, you can put that in a nice potli. If you can't make a potli, just use an old sock. It's very easy. You put it into the sock and you tie a knot, and then you heat that over a griddle and use that on the palms of the person's hands. Okay, and that again, these are all very Ushna Vidya, very Tikshna. They're very hot in potency. They're very penetrating. And because they're cooked in the castor oil and because they have this particular action, it'll help to further enhance the absorption of these particular oils that you'll be using, as well as it helps to give the heat factor. So in all perspectives, it will be pacifying of Vata. Another thing why Snehana would work really, really well is because it lubricates all the structures around. And in lubricating the structures around, it will help for free movement of Vata. So you may think, what is the difference between this lubrication and the moisture that we were just talking about that causes the problem? The difference is that moisture may not necessarily be lubricating. It may just be moisture buildup. Whereas this particular type of moisture is lubricating. It's slippery. So that's why we want to use Snehana, because of the fact that it is creating a slippery nature in these fine, tiny spaces and channels. It allows for easier movement of Vata. And if Vata gets to move out freely, move in and out freely, then it automatically will help to subside the pain and all the symptoms that are occurring. Okay? So you can use Patra Potali Sweda, or you can do even an upanaha. Upanaha is the warm paste application. So for instance, you can use the rasnadi powder with lime juice as what we had done as one of the practicals. Or you can even here also, you can use fennel, which is what we did over the weekend, the fennel powder mixed with warm water, or you can even use fennel powder mixed with the lime juice, and just make sure that it is a warm paste. The paste cannot be cold, it has to be warm, and you want to get it as hot as the person can withstand. You don't want it to be just warm to your touch. It should be heat enough for the person's touch. Because another practical application here is whenever there is aggravation of vata in someone, it has been described that they crave heat because vata is extremely cold in nature. It induces more cold, so the person does crave heat. So what does that mean that they crave heat? That means that they can withstand more amount of heat. So for instance, if you are testing the temperature on your hand and you don't have a vata aggravation, for you it may seem hot, but for the person who has a vata aggravation, for them it actually feels warm. It probably won't feel hot. So they will ask you to, you can put it more hot. So that's why we always ask that question, is this okay? Is this too hot or is it too less? And the fact, this is one other way of upashaya anupashaya, of where you're testing and doing a trial and error. Because if the person can withstand a high amount of heat, that kind of indicates how much of vata is actually there. And the more you do the treatment, the less amount of heat they'll be able to withstand. So the first day, they need a lot of heat. The second day, maybe not so much, a little bit less. The third day, even less than that. And the fourth day, they can probably be equivalent to how much heat you can withstand. So as you know also that your intervention is working by how they respond to just the heat factor, okay? So just remember that when you do this paste application, that it should be hot, that is suitable for the person who is receiving it. So make sure and test and ask them. That's why, again, there's no standard for how hot it should be, because it depends. It always depends. Okay? Okay, other option for doing swedana or for inducing heat. You can actually bandage. This is bandhana, means to bandage. You can actually, this is very similar to the wrist splint. But the only difference here is we're using it with herbs that are vata pacifying. So apart from just bandaging the area, bandaging does help because it helps to compress vata. And vata does tend to respond quite well to compression if it is moving excessively. So it can help to cause that compression. Better than just compression alone, because if you do it compression without any vata pacifying other substance, it's going to be a temporary relief, but not a permanent relief. It's not curative, it's more symptomatic relief, okay? So in this situation, you can use Dhanvantra Taila, which is a good option for pacifying vata as well. And it is on its own kind of heating. So you can use even that as one type of heat. So you can use a bandage soaked or a gauze soaked in Dhanvantra Taila and bandage it. And the way how that induces heat is you're applying sneha plus you're wrapping it. So that wrapping helps to keep the temperature there. That's how it is considered a type of swedana. Okay, so it's not a direct type of swedana, it's sort of an indirect type of swedana. Okay, or you can even use these castor oil packs. That's another. Castor oil in itself is very heating in nature, so therefore you can use a castor oil pack, and that's another form of swedana that you can do. So that's kind of, as long as if there's castor oil that's coming in direct contact with the skin, great. But if it's sort of sealed, then you want to apply some on and then use the castor oil pack, okay? So these are different methods for the Vataja type, basically Sneha and Swedana. For the most part, Carpal tunnel, if it is just a recent onset or just a localized thing, then an external application is sufficient enough to pacify or to correct this condition. If it is more chronic and you start to see other systemic issues of aggravated vata, then you want to use a systemic approach. So you would use this as well as integrate the systemic approach for pacifying vata. And that we have talked about again, same, depending on how severe it is, you can use diet and lifestyle, or you can use diet, lifestyle, and herbs, or you can go for diet, lifestyle, and herbs and some sort of purifactory or shodhana type of treatment, which is you can use duvirechana. Okay, next type, vata and rakta or pitta. So in that instance, where you have carpal tunnel, where there is inflammation, there is fluid accumulation, then in that situation, just like in vata rakta, you want to do ruksha sweda, because you do have to help to reduce the amount of pressure that is being built because of the inflammation or because of the moisture that's there. So the best thing to do is ruksha sweda. So an easy way actually to do ruksha sweda, especially in this season, and if you're in this area, you would ask them to, they can take their hands or their wrists and put it up against the bricks on their fireplace. And make sure that it's not too hot that it's gonna burn them. But if it's warm enough or hot enough according to what they can withstand, the bricks on the fireplace is hot. You want to make sure that it's hot. It's hot as well as it's drying. So that it can be a very easy method of a ruksha sweda. So if they had their fire going and the bricks are nice and warm and hot, they can actually help too. They can press their wrist against the brick, and that can be their form of ruksha sweda. If the bricks are too hard, then they could just hold like a thin cloth or like a kitchen towel or something in front of their hand and then press it against that. Again, they will get that dry heat. And that is one of the ideal methods for doing ruksha sweda for the hands. Or you can use, again, a sand poultice. If you can't make the poultice, put the sand in the sock, tie the socks, and just heat it up on a dry skillet. And so that can be used again to apply heat on the hand. And that's again if it is a condition where there is inflammation, where there is fluid, and you can basically palpate and see if the fluid, you look for all those other signs and symptoms indicating that there is fluid there. Okay, so you want to do ruksha sweda. So once you find that there is no more there's no more indication of any fluid there, those symptoms have started to subside, then you can do regular sneha sweda, or you can also supplement the ruksha sweda also with an internal combination that will help to pacify the vata and rakta or pitta internally as well, systemically. So in that you would opt for, again, the tikta rasa kashaya. So a tikta rasa predominant decoction or a bitter decoction. So an example of that again is Rasna Saptaka, which we had talked about, or Gandharva Stadi. So here comes Gandharva Stadi again. So now do you understand why in the first module I introduced you to this combination? Because this is a combination that works well for just about everything. So hopefully by the end of all of our modules, you guys are going to be so familiar with Gandharva Stadi that it's going to be probably one of the first things that pops into your head the minute a client comes in and says they have some kind of vata issue. Automatically this will come up, but ideally if we look at it and we look at the properties of this, it really does suit a lot of the conditions that we have. Usually I don't tend to generalize. I don't like to generalize that this can be used for everything. But for most of the conditions that we're describing, and we're looking at the actual pathology, we're looking at the nidana, we're looking at the samprapti, we're looking at the rupa, And in looking at all of that, and the majority of what tends to come up, this simple combination does tend to address all of it. So again, there is specific indications, but now you know where all you can use this. And this list is going to keep growing. So that's why we haven't created the list yet of all the medicines and what all you can use it for. The list for Gandharva Hastadi is going to keep building and building and building of what all you can use it for. But why I don't want to make that generalized list is because I want you to know exactly where and when you can use it and how to use it. Okay? So hopefully now this has become a bit more clear. Okay, so that's all that we have for carpal tunnel syndrome. So do we have any questions? And feel free to, to unmute if you'd like to ask the question directly. That's fine.
They must be all set.
I know that seemed like a lot too. Well, thank you. I'm glad it was fairly clear. I thought this was actually going to be somewhat of a small topic. And then after when I started writing and I started making notes on it, I realized it's actually a bigger topic than I thought it was. So I'm glad that, we got to cover, some most basic conditions for carpal tunnel. And, just in general, how many of you have had cases or had people come in with this condition? Yeah, I know, Matthew, you've probably had quite a few.
Lots.
Yeah, because it's so common these days. It's so common. So I wanted to make sure that we cover things that you guys are going to be coming across, And then when you get it, you're like, oh, I know exactly what to do. Okay. Well, if we have no more questions, then I think we're all set for tonight, and I will see you guys again next week.
Thank you.
Thanks, Anusha.
You're welcome.